they were now saying, no, we're not going to grant you. And I was just like, what? And so, I got together with Paolo, and immediately it didn't make any sense to me because I'm like, this doesn't make any sense. And so we sat down and thought about it. And yeah, to be very honest, our diabetes technology involves targeting two particular proteins. And if you look around, these two particular proteins are pretty much everywhere in the body. They're pretty ubiquitous. They're all over in the body, or at least according to the book, whatever antibody they were using to detect it was binding to other areas as well.
Mm-hmm.
So you can't necessarily say the protein is in different areas, but you can say what they were using to detect it showed up in different areas. So if I was somebody trying to only target the beta islet cell, which is your insulin producing cell, it would have made no sense to target these two proteins because they're everywhere. You
Mm-hmm.
can't try to target something if it's everywhere. And so we went back and said, clearly our drug is able to it's not only targeting this protein, but something specific that's what we call a post-translational modification. There must be some kind of post-translational modification that it's also picking up on
Mm-hmm.
only on this cell type. Why isn't it going over to the liver? Why isn't it going to the lung? It's only going to the pancreas and only this specific cell. And that is not something you could have read and known that. What you would have read would have sent you everywhere. And so I think we had to finally, convey that to them and let them know, no, this is not something any ordinary scientist would have figured out. It's something that we found out through various, hard work, which Paolo and his postdocs did many years ago.
Mm-hmm.
So we went from turning that from a no to getting some of the broadest coverage ever given for an initial patent application. Our patent attorney, she's like, I've been doing this for 20 years. I've never seen this kind of broad coverage. It's such broad coverage that you almost don't need anything else. Now we are gonna submit a couple more things to give us even longer patent life, but like the wording is that nobody can use an aptamer. So we use an aptamer. Nobody can use an aptamer to target our two proteins in the field of diabetes. So they can use it for something else, but in the field of diabetes, so this will cover anything. So if pharma tries to come up with a different aptamer, so they say, okay, we're going to stay away from the aptamer you have. We're going to come up with a different aptamer. Doesn't matter. As long as it's an aptamer, they can't use it. And we've pretty much figured out that you can't use an antibody because antibodies aren't specific enough.